Carpal tunnel is a very common problem seen by many people. It occurs in women more than men, and it occurs as we get older. It is due to compression of a nerve that comes into the palm through the wrist.
So do you have any pain?
Typical early symptoms are numbness at night that might awaken you from sleep. You might have numbness or tingling with certain activities during the day, like driving a car or typing. Daytime symptoms, if they do occur, sometimes occur later and sometimes many months after the nighttime symptoms start. Some patients get carpal tunnel after an injury, but more commonly it occurs as we get older and the tissues at the base of our palm overlying the nerve thicken. There's never been any data to support the fact that computer use or keyboard use, for that matter, even old standard typewriter use, was an actual cause of the carpal tunnel itself. So there are several risk factors such as diabetes and some thyroid conditions. Patients who are overweight are more likely to have symptomatic carpal tunnel syndrome. And lastly, women who are pregnant, very often at the end of their pregnancy, will get symptoms of carpal tunnel. With pregnancy, these symptoms usually resolve after delivery of the child. In a very few patients, they do persist and need to be treated after delivery. One of the most common early treatments for carpal tunnel symptoms is a splint worn at night. This is a very good way to help control those symptoms, but the symptoms typically worsen and become resistant to nighttime splinting. You can treat carpal tunnel with injection of cortisone, but usually the end treatment for all patients with carpal tunnel is surgery. The surgery that I do is done through a small open incision at the base of their palm. It's under local anesthesia only. The surgery itself takes between 15 and 20 minutes. And when they leave surgery, they have a light bandage on their hand that they wear for about 4 or 5 days. They can, if they desire, drive themselves home after surgery. And really, right away, I have patients using their hand for light things. I have patients who, prior to surgery, have not had a full night's sleep for months. And sometimes the very first night after surgery, they get their first full night's sleep without being awakened due to their numbness and pain in their hand. I've had patients give me hugs, give me kisses, give me presents, just because of that ability to sleep at night. I am Dr. Carrie Swigart. I am a hand surgeon with the Department of Orthopedics at Yale Medicine.